You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is I talk to people about exposures before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So a medication, a vaccine, and in some cases, an illness. Today, we are going to talk with a special guest about long COVID. To talk with us, we have Dr. Alexandra Yonts. She is a pediatric infectious disease physician at Children's National Hospital in Washington, D.C., and an assistant professor of pediatrics with the George Washington University School of Medicine and Health Sciences. She is also the director of the Children's National Post-COVID Program Clinic for children and adolescents with long COVID. Dr. Yance, am I correct in thinking that you are affiliated with one of our partners, the American Academy of Pediatrics?
That is correct. I am a member of the American Academy of Pediatrics as a pediatric trained physician and fellow in infectious diseases, and have done some work with them to help develop and update their long COVID guidelines and provide additional guidance on COVID vaccine in children over the past year or two in the pandemic.
Excellent. So you are just the person that we want to talk to. And Dr. Yance, you're also a mom, is that right?
Well, a mom to be. I am currently 36 weeks pregnant with my first child, so will very rapidly be experiencing all of the joys and challenges that come along with motherhood, but have already had that fun in pregnancy.
Well, congratulations. And really the most important question, how are you feeling?
Generally quite well, getting tired, ready to be off my feet a little bit more. But thank goodness it's fall now and the temperatures have cooled off. That's made it a much more pleasant last few weeks.
Well, that's good. I'm not 100% sure tired is going to go away anytime soon, but best of luck with your upcoming delivery.
I hear it's a different kind of tired. So, yes, absolutely.
I would agree. Let's get started. Can you start off by telling us what is long COVID?
Absolutely. And it's a very complicated question that I will say the answer has evolved over the last 2 years, but really over the last 6 months as we've tried to really define long COVID and separate this sort of syndrome that impacts children and adults after COVID infection from other lingering symptoms that might be comparable to other viral illnesses. So my favorite and the definition that I use is one that was developed by the WHO, or the World Health Organization, that defines long COVID as symptoms lasting for 12 weeks or more after initial COVID infection that may fluctuate or relapse, and most importantly, impact daily activities of living. So not just your sort of lingering cough that might be annoying or an occasional, runny nose, congestion, but things that prevent kids from going to school, participating in their sports and activities, or interfere with any of those other things that are part of the job description for children and adolescents as they're going through life.
So I've certainly heard about long COVID with the idea being, the virus itself can pass, but there can be these long-lasting effects. What should everybody inside and outside of pregnancy or breastfeeding know about long COVID?
The first thing is to know that it is a real entity. One of the challenges has been trying to separate things like fatigue and stress that we've all felt in the pandemic from, the effects of society and changes in lifestyle based on lockdowns and precautions and disruption of life. But we are finding and have found with extensive research now, this has become one of the most researched topics in the medical literature over the last 6 months, that there are people who truly have fatigue on a next level, as well as things like headaches, cognitive dysfunction, so you may hear it referred to as brain fog, and a vast range of other symptoms that can be from rashes to joint pains to unusual vascular symptoms. All of those things preventing people from doing their daily lives, those are real, and those need to be seen and heard and validated. The other thing that's really important to know, aside from establishing that this is a true medical diagnosis, is that we don't truly know who is at highest risk for long COVID. We have learned some things that suggest those with a more severe initial infection, in particular kids that end up in the hospital, are at increased risk for these prolonged symptoms or long COVID, as well as those that have underlying chronic medical conditions, a history of allergic disease, and there's a slight risk for being female, but that's a little bit debatable depending on the literature. But beyond that, we suspect there may be other roles at play, but can't say, oh, you're definitely not at risk for long COVID because X, Y, or Z. And each new infection that someone may get with COVID is a potential chance of developing these long-term symptoms.
So for people who are pregnant, trying to get pregnant, or breastfeeding, is there anything in particular they should know or be aware of in terms of long COVID?
There has been a very limited number of papers published that looked at long COVID symptoms in pregnant women who had COVID during their pregnancy. I say very limited because they were survey-based, so did not have a great response rate.
Sure.
And they did show there was a higher level of fatigue in women who got COVID during their pregnancy, after pregnancy, than those who did not. However, there are multiple additional studies being done by the National Institutes of Health, or NIH, and other large consortiums looking at the longer-term effects, including long COVID, on mom and baby in pregnancy that are ongoing. So still a lot of answers to have, but my general advice is avoiding COVID infection avoids the risks of these potential sequelae to you and to the baby. Aside from long COVID, there are multiple other risk complications associated with COVID infection and pregnancy, including issues with the placenta, severe illness, preterm delivery, and other things with the acute infection that obviously are better to avoid as well.
Absolutely. And can long COVID be prevented?
That is a matter of a little bit of debate. There have been two really big studies that have looked at the role of vaccination and the risk of development of long COVID. The first study was, again, when I say large, I'm talking like 30,000 patients, performed in the United Kingdom, and initially suggested about a 50% reduction in risk of development of long COVID symptoms in those that were vaccinated. A subsequent study done here in the United States through the Veterans Administration, so again, these were all adults and likely not including pregnant women, or a very small minority of pregnant women in the VA, showed about a 15% reduction in risk. And then a larger meta-analysis that looked at a wide number of studies, I think at least 20, that was reviewed about 2 months ago, had really mixed answers. So all of that should be taken in context with new variants coming onto the field, time from initial vaccination, waning protection. But studies do suggest there is some degree of benefit of vaccination in protecting you against long COVID, but how strong that protection is and really what the timing of needing to re-up your protection is not yet known.
So thinking about the general population, not just pregnancy and breastfeeding, but also in children and adolescents, and really all of us, what are some tips for either treating or coping with long COVID?
So I have great references, and happy to provide this if there are links available to the podcast, for guidelines that have been developed, primarily for clinicians, but also resources for parents, family, and children through support groups for the long COVID community. Organizations like Survivor Corps and Long COVID Kids have been instrumental in both raising awareness about long COVID, but also pushing for research, for funding, and developing a patient-led research consortium into this area to get at the actual physical, biological mechanisms of what's going on in patients. So those are some really great resources that I encourage everyone to think about, especially if there's someone in their family that's affected by this. Beyond that, the first step if you have COVID and have any lingering symptoms is to talk to your pediatrician. In the early phase, the first 4 weeks after infection, they can do some initial lab screening, monitor your symptoms, and make sure there's nothing else going on. As we all know, other things, life does not stop because of COVID in terms of other infections or other conditions. And then if symptoms persist beyond that 4 to even 8 week mark, there are subspecialty clinics, as the one we have at Children's, that have multiple different providers from multiple subspecialists that can do a more thorough evaluation and put together a management plan. But a lot of the advice and management to date has focused around pacing and goal-oriented return to activities, because the one common thread in all patients with long COVID is this fatigue, and in particular, fatigue that is worsened by exertion. And to say that, I mean, you're feeling pretty good one day, you go out, you have your normal day at school, and then can't get out of bed for the next 3 days. And that is a hallmark of other post-viral diseases like chronic fatigue syndrome that's been traditionally associated with mono infection, but avoiding that, what we call push and crash cycle. And that can be hard. Kids, especially when they're feeling good, want to do all the things at full speed. But what we do, a lot of our work is helping them realize that that's not going to be possible immediately, setting goals for what can you do and building up that amount of tolerance over a slower period of time without avoiding hurting them and putting them, 3 steps back for a longer period of time.
And I know that, the research is ongoing, and of course, nobody wants to have long COVID symptoms, but it is nice to know that, this is something that, as you said, people are recognizing, identifying, taking seriously, making steps and treatment plans and support out there to help the families through this.
Yes, it is. It has been, I will say, a challenge. As a lot of these syndromes go, they're pretty nonspecific, and it's hard to quantify or, really put a finger on how bad fatigue is with patients. So you get reports that are highly variable, and all that. And providers have traditionally not known what to do with this. So it's left a lot of people feeling sort of lost and alone. So again, it's not good that anyone has gotten long COVID, but the sheer volume of people that have had this infection and developed this syndrome at one time has really led to a lot of advances in research on how to handle these conditions, what treatment might look like, and quantifying a population that has it and bringing those people into the public view. So I think this will help lots of other individuals with post-viral syndromes that have been long sort of ignored or lost. But we still have a way to go.
Yeah. Which we can say about most things, but, the appreciation is there that, again, like you said, it's so important to even recognize that it's out there, that it is a real thing. So we appreciate the work that's being done, absolutely. And as we wrap up this episode, Dr. Yance, is there any final thoughts you'd like to leave our listeners with?
I think I'm really glad that you're calling attention to this issue. And I want any listeners that have concerns about their child following a COVID infection or concerns about how they're doing in school or handling life to push their pediatrician, to talk to somebody. And if they don't get an answer or don't feel like they're getting the care that they need, look a little bit more broadly. It is a struggle, but There are things that can be done, accommodations in school, pacing things that we have discussed, that can help them get better faster. Most kids do recover from long COVID in a period of, it could be anywhere from 3 months after to a couple years, depending on the kid, although most I'd say it's less than a year. But that's a year of lost opportunity in growth, development, learning, all the normal things kids are supposed to do to become, at least semi-functional adults. I can't say we're all functional. But, be the person that they're supposed to be. And so anything that can be done, even if they're improving, to help them improve faster and get back into some activities that they enjoy is really important to pursue.
Absolutely. Thank you so much for being here. And as you said, helping us call attention to this important issue. And we would like to wish you the very best of luck with your delivery and your growing family.
Thank you so much, Chris. My pleasure.
And that's all for this episode. As always, thank you so much for listening. This episode contains evidence-based information that's current as of the day of recording and may change as more data becomes available. To get the very latest information about this topic in pregnancy or breastfeeding, please contact a mother-to-baby specialist. You can call us at 866-626-6847. Contact us via text message at 855-999-3525. Or you can visit our website, which is mothertobaby.org. On our website, you can chat with us. You can find our fact sheets, our podcast, and lots of information. And if you have an idea for the podcast, or if you would like to be a guest, please feel free to email us at contactus@mothertobaby.org. Be sure to catch all the new episodes of the Mother to Baby podcast, so hit that subscribe button. You can find us on Spotify, iTunes, or however you get your podcasts. Also, they're available on our website, including some of our older episodes. As always, remember, Mother to Baby is here for you. So until next time, take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.